The Mastercard Foundation announced a $1.3 billion donation on Tuesday to boost the continent's response to the coronavirus pandemic. Public health experts hail the move as a significant step to get vaccines to some of the world's poorest people. The funding will be distributed over 3 years in partnership with the Africa Centers for Disease Control and Prevention. Among other things, it's intended to help acquire vaccines for more than 50 million of the continent's 1.3 billion people, improve its vaccine manufacturing and delivery system, and to strengthen public health institutions as well. Now, the foundation's pledge is one of the largest private such donations made in the pandemic fight. It comes amid a growing outcry over the lack of vaccine supply for much poorer countries, a significant number of which are right here in Africa. So let's examine some of the details of this initiative in detail. Dr. John Nkengasong is director of the Africa Centers for Disease Control and Prevention. He joins me now from Addis Ababa in Ethiopia. Thank you very much for your time this evening, sir. So the foundation is providing $1.3 billion to the Africa CDC. But walk us through how this is being split between vaccinations, vaccine logistics, and vaccine manufacturing.
Thank you for having me on your program. Over 80% of the funding will go towards acquiring vaccines, the distribution of the vaccines, and supporting countries to roll out the vaccination programs. I mean, as we have said at Africa CDC several times, we have a simple formula for our approach where we say vaccines must be accompanied by a vaccination. And if we do that, they save lives and save economies. So a big chunk of the money will go towards supporting vaccine acquisition and the vaccination itself. Then some part of the money will be used for supporting countries in the area of human capital for vaccine development in Africa. And then, of course, to strengthening Africa CDC itself. That is very broadly how the partnership is structured.
At this point in time, do you have any specific vaccine candidates that you're intending to acquire? Because I know we have at least 7 or so that have been approved for emergency use by the WHO, but are there specific ones among those 7 that you know you can get your hands on relatively quickly?
No, absolutely. We have the Africa CDC and the African Vaccine Acquisition Task Team, what we usually call AVAC, have secured up to 220 million doses of the Johnson & Johnson vaccine, with an option of scaling that up to 400 million. So within the context of that contract with Johnson & Johnson, this partnership will buy into that. We'll get the 50 million doses from that. And the deliveries will start from the beginning of August this year. So I think we are very excited with this. This is truly a historic and a game changer in our fight against COVID-19. We truly are appreciative to Mastercard Foundation for this historic initiative.
With regard to logistics, though, because part of the problem with getting vaccines distributed across the continent is that the storage infrastructure is usually quite difficult to actually find and build it out in places where historically health sectors have been grossly underfunded. Is that part of the reason why even just distributing the doses we have is proving to be problematic?
Well, the challenge we have with our situation with vaccination in Africa is twofold. One is timely access to vaccines. We just don't have vaccines arriving on the continent in a predictable manner. I think that is one. Then the second is the preparedness, so to roll out vaccine at scale. We as a continent have never been able to vaccinate up to 200 million adults in 1 year. So this is a whole new game exercise for the continent. But however, the continent has the capacity and capability of vaccinating. Just this year or last year, Ethiopia was able to vaccinate 12 million children with the measles vaccines in the middle of this pandemic. So it means if we have vaccines that arrive in a predictable manner, we can organize ourselves and roll out the vaccines and put them into people's arms.
Okay, with respect to manufacturing, Aspen Pharmacare, of course, is working with Johnson & Johnson to produce that shot in South Africa. Egypt, we understand, plans to start producing the Sinovac shot from around June, later this month, in fact. Under this deal, when we talk about vaccine manufacturing, where's the money going? Is it going to be augmenting those manufacturing efforts, or is it going into entirely different greenfield ventures?
The money is going to be looking at the collective, which means there are certain countries that are already in the vaccine manufacturing exercise, not necessarily COVID vaccines, but other vaccines, like the Pasteur Institute in Senegal that has many years of experience manufacturing the polio vaccines, and other sites in South Africa, Egypt, Tunisia, and Morocco. I think those are countries that already have that capacity. But there are other countries like Rwanda, whose President Kagame has expressly asked for and is supporting the manufacturing of messenger RNA vaccines. So what we are trying to do is bring everybody together so that we look at the entire value chain for vaccine manufacturing. So these resources from the Mastercard Foundation will facilitate our ability to unite countries, have a continental plan that can enable us to work as a network of vaccine manufacturers then.
Okay, one last question for you, sir. So the AU's target is to vaccinate roughly 750 million people by the end of 2022. That's barely 18 months away. And at this point, we have less than 2% of adults across the continent having had their first shot of a COVID-19 vaccine. So theoretically, we need to get at least 1.5 billion doses between now and the end of 2022 into the continent and into the arms of millions of adults. How will that happen, given all the resource and logistics constraints you've pointed to?
So that is very feasible if we do the following things and do that collectively. We have the tools in our hands to make that happen. First of all, the big countries that are sitting on excess doses of vaccines must release those excess vaccines immediately so that we can plan accordingly. I mean, the key in rolling out such a massive program is predictability. If we know when vaccines are coming, what types of vaccines, then we can work together in partnership with others to make sure that we support countries to roll out the vaccine. But we need to have that information in a predictable manner. So we are very encouraged with what the United States government announced this week, that they will release 25 million doses of vaccines. We are very encouraged with the announcement that happened 2 weeks ago from the Global Health Summit in Rome by France, Germany, and others, that they will release additional doses of vaccines. That is one. The second thing we must do as a continent is that each country must be ready, what I call shovel ready, to move the vaccines quickly once they arrive. And I think this partnership from the Mastercard Foundation will enable us to create that kind of a support mechanism to facilitate the rollout of vaccines when they do arrive. And we do have an AVAT mechanism, that is the African Vaccine Acquisition Task Team, that has secured up to 220 million doses of vaccines. That's a lot of vaccines out there, which will begin to arrive the countries from the start of August there. So I think we are lagging behind seriously, but with a strong solidarity and cooperation, we have a good chance of fighting back very hard and immunize our people appropriately.
But isn't the weak link in the plan, sir, the fact that for a lot of the Western economies that you've pointed to, they really have no obligation to actually deliver these vaccines essentially on time? After all, they went ahead and bought up enormous amounts of supply. They're still hoarding it. And the supplies that we are getting in these donations are really a drop in the ocean. 350,000 COVID vaccine shots came into Kenya this week, for example. And that's not really predictable. Wouldn't it make sense to prioritize securing supplies, buying them outright instead?
Well, you have to deal with issues of supply. I mean, the challenges that we have is not necessarily financial. I mean, COVAX, for example, has raised a lot of money, but the key challenge and limitation is where do you get the vaccines? That's why the agreements and contracts that we have with Johnson & Johnson offers a lot of hope and promise because they are secured. I was in South Africa just 2 weeks ago and was at the Aspen facility to look at these vaccines. I think the partnership with the Mastercard Foundation offers a lot of hope. We continue to believe that this is a moral issue, and those sitting on vaccines should truly be on the right side of history and release those excess doses in a timely manner so that we can come out of this pandemic together.
Indeed. We'll be there for the time being. Dr. John Nkengasong, Director of the Africa Centers for Disease Control and Prevention from Addis Ababa. Merci beaucoup for your time tonight.